Hello and welcome to the program. I'm your host, Neal Howard, here on Health Professional Radio. Thank you for joining us. Our guest today is Mr. David Goldsmith. Now, David is Chief Strategy Officer for WEGO Health, and he's here to speak with us about patient leaders, who these people are, and how these people help connect each other and healthcare companies in order to drive positive change. Welcome to the program, David Goldsmith.
Thanks very much, Neal. It's great to be here.
Thanks. Now, give us a bit of a background about yourself. You're currently the Chief Strategy Officer for WEGO. What exactly is WEGO involved in?
So WEGO Health is very much a mission-driven company. We're focused on transforming healthcare by tapping the experience and the skills and the insights of patient leaders. And at this point, we are the world's largest network of patient thought leaders and advocates. We have well over 100,000 people across more than 150 health conditions. And we've been working with a pretty broad range of clients in the pharmaceutical and life sciences industry for many years, as well as a lot of agencies and organizations across the healthcare industry. Mm-hmm. And we're really looking at how do we bring these patient advocates and influencers into healthcare in order to ensure that we're achieving this goal of building a far more patient-centered healthcare system.
How do you get all of these people on the same page as advocates for the patient?
Well, we don't worry too much about getting them on the same page because these are folks who are themselves totally entrenched in the healthcare system by virtue of having to manage chronic and complex conditions. And these are people who are, by any measure, hyper-connected, they are hyper-engaged, very informed. And what makes them very unique is that they have really taken this health journey, which has, by any definition, been an extremely challenging and unfortunate aspect of their lives, and turned it around not into just something that they alone have to deal with, but something that they can really work or use to share with other patients and other caregivers to raise awareness and to help others. So these are people who have in common an ability to take their social channels, Facebook, Twitter, YouTube, and other channels, and really use those to amplify their voice, to connect with their peers, and to build communities themselves. So these are people who are on a day-to-day basis transforming the industry in their own way. We often refer to them as micro-influencers. They're not always the people who are well-known. They're not Kardashian-level influencers, but they are within their own patient communities, very well-known, trusted, and authentic voices, and people look to them to help themselves better navigate and manage their care and sort of day-to-day decisions they're making about how to cope with a very complex condition.
Do you find that there exist communities within this community of patient advocates? I mean, you take somebody like Barbie Engel, for example, who suffers with chronic pain. Is there, say, a chronic pain niche within this network? And then is there a lower back pain or a spinal injury? You understand what I'm saying? Is that something that takes place, or is everybody kind of, when the patient is involved, everybody gets on board no matter what their particular, for lack of a better term, area of expertise may be?
Well, it's a great question. I think one of the things that's so striking about working in this patient community now is just seeing the diversity of voices out there and the diversity of online patient communities that have arisen over the years to provide support to patients with these conditions. And to your point, you may find it relatively easy to connect with other people who, like Barbie Engel, are dealing with chronic pain and learning how to better manage that through a number of different, support groups, and hearing how other patients have sought out different kinds of remedies, for example, through alternative medicine and therapies to treat their pain. And also just to really share stories with one another about how to cope with that day-to-day challenge, of course, of dealing with something so vexing as chronic pain. So within those communities, though, you see self-organizing of people around specific conditions. There's a condition, for example, called ankylosing spondylitis, one I had never heard of until a few years ago. It's a very difficult condition to diagnose, and many patients talk about having the need to see numerous practitioners before they even get an accurate diagnosis. So within the pain community now, you can find people who are dealing with that condition. And there are countless examples of these communities that are being spawned very organically by virtue of some of these leaders stepping up and helping to bring people together to learn more and share information with each other. And at this point, this is a very vast and complex ecosystem, I would say. One of the things that's a distinguishing characteristic of these patient leaders who we work with is that on average, they're connecting with over 15,000 people each month. So if, for example, someone like Barbie posts something on her Facebook page or perhaps through Twitter, she's going to connect with literally thousands of other people. That makes her a critical influencer in the pain community. Another interesting characteristic is that almost 75% of the leaders in our network today are participating in multiple online communities. In other words, they may spend some time in a Facebook group that's focused on their condition, but they're also tied into other patient communities, and they are very active contributors in those communities as well. In other words, they're not just reading, but they are on average 3 times more likely to share information on those networks and publish reviews of things like health apps and things that they're experimenting with so they can share that with their communities.
How much support do you receive directly from physicians who are involved with WEGO Health or involved with any other patient advocacy endeavors? Not necessarily financial support, but...
Sure. The practitioner community increasingly is recognizing that patients who have taken steps to learn more about their condition and learn about ways in which they can better manage their health and to understand the importance of being really an active participant in their care are people who are likely to have better outcomes than those who don't have that level of engagement in their care. So more and more you see practitioners embracing patient online communities in order to basically see that as a way for patients to be learning more about their health and about how to be actively engaged in their health. So it can be at times controversial. I know from talking to even doctors I know personally that some have been concerned that these networks can be a source of misinformation around certain kinds of treatments, for example, or therapies. And to some extent, that may be a reasonable concern, as it should be anytime there's information that's being shared that may or may not be scientifically, grounded. But at the same time, when you really take a deep look at the kind of information that's being shared, almost invariably it is people talking about how they cope with their condition, how they have sought out information to learn more about ways of treating their condition. They're very rarely, being prescriptive. So they were, in fact, they're the first to suggest to their peers that if they're going to try a new therapy or any kind of new medication, et cetera, that they, of course, confer with their doctor and ensure that, again, they're not making any decisions without having their doctor involved, as long as that's, feasible to do. So, again, doctors really see this as an important new source of information and support for patients to become much more engaged in their care.
Where can we go and get more information online about WEGO Health?
WEGOHealth.com is the starting point. That's the place where you can learn about the folks who are in our network, as well as some of the different solutions that we are offering to patients who want to be involved in the kinds of initiatives that we're working on with our industry partners. And of course, it's also a way for companies and healthcare organizations to learn more about how they can tap the expertise of these patients. We've just recently launched a new platform called WEGO Health Experts, and that's a way for companies to hire these patients on demand and bring them in to be consultants on projects that range from includes all kinds of things, social media campaigns or market research or recruiting patients to be a part of the patient advisory board. So this is our newest endeavor, and we're finding already that it's making it much easier for healthcare organizations now to tap the expertise of these patients. And we encourage anybody to check out our site to learn more about that.
David Goldsmith, Chief Strategy Officer for WEGO Health. Thanks for coming in today, David.
Thank you, Neal. I appreciate it.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with David Goldsmith. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download at SoundCloud.